Sister,
All
please,
right,
can
so
I start?
please, group one, you can start. I wish you good luck.
Yes, sister. Please, we are presenting on traditional birth attendance, which is TBA. And according to WHO...
Please, because I was waiting for the recording, can you start from the beginning? Your first slide for us, so that we will start from there.
Yes, sister. Okay. Please, we are group one and presenting on traditional birth attendance, which is TBA. So we are going to define who a TBA is. And according to WHO, a TBA is a person who assists the mother at childbirth and initially acquired her skills delivering babies by herself or by working with other birth attendants. And they are usually in the developing countries. They assist women during labor and delivery, and they learned their skills through apprenticeship or personal experience rather than by formal training. They may not receive any formal training. So, and there is no specific requisites such as certification for them. And they are mostly herbalists or traditional healers. And they are older women who are generally illiterate. So with the history of the TBAs, they were initiated through apprenticeship, and they used both spiritual and physical methods to perform procedures. They usually used herbs and spiritual artifacts. So between 1970 and the 1990s, WHO promoted the training of TBAs as a strategy to reduce maternal and neonatal mortality. As a strategy to reduce neonatal and maternal mortality. So we are moving to the goals of the TBA training. Please, with the goals, the goal was to reduce maternal and infant mortality. The goal was to reduce maternal mortality and infant mortality by improving skills of the TBA and increasing the number of births conducted by the trained TBAs, record keeping, and health education. So they trained the TBAs in order to educate pregnant women on both antenatal and postnatal care. And they also, and with the record keeping, they trained them in order to allow the health system to monitor their activities. Okay, so we are moving to the roles of the TBAs in the community. We have referral. They serve as a bridge between the community and the formal health system. So they usually accompany the women to the health facilities for delivery, or where there is any difficult delivery, they refer them to the hospitals. And we also have health education. They educate the mothers on activities such as promotion of breastfeeding practices, such as promotion of breastfeeding practices. We also have case findings and counseling. Because they are with the women in the communities, they usually visit them in their homes to find out if there is any particular case, or if there is any pregnant woman, if there is any pregnant woman in the community, they make sure they attend to them, and they also provide counseling. They conduct deliveries, and they also promote breastfeeding, and they provide basic health care in the communities as well. And then they strengthen the link between the community members and the formal health system. So please, we are moving to why some women still prefer TBA and home deliveries. We have economic and pragmatic reasons, which is financial difficulties and practicality. With the financial difficulties, they think when they move to the former health system, because of cost, they think it's more expensive rather than delivering at home. And with the practicality, because they are older women, they think they are more experienced than the midwives in the facilities. And also with the trust and tradition, they think it has been there for long, like for them to deliver at home. So they trust that the older women are more experienced to conduct the deliveries. And with the perceived need, the importance of having a safe delivery, they think when you deliver at the TBA's home, it's more safe because they are experienced. And we also have knowledge about maternal and neonatal health. They think the older women know more about maternal and neonatal health and access to services, physical access. Sometimes the distance between the villages and the facilities. So they think that once the TBAs are around, they can easily have access to their service. And also social distancing is also with the distance to the nearest health facilities, and community members' perceptions of providers' knowledge and skills. And under it, we have providers' experience and behavior. So as I already said, they think the older women are more experienced and they will not shout at them. They'll make sure they deliver safely. And we also have previous experience because most of them have been conducting deliveries for long. The pregnant women feel safe in their hands because they think they are more experienced. Okay, and also we also have ignorance. Some people still believe that the trained TBAs are only aimed at women with experienced obstetric complications. So we are moving to the harmful traditional birth practices. So with this, most TBAs were performing some activities which were harmful, which is the use of herbal uterotonics and fundal pressure. Some were still giving fundal pressure during delivery. And also, they use palm oil as lubricant for vaginal delivery. Blowing of beer bottle to deliver placenta. Early baby bathing. They think that just after delivery, they have to bath their babies and not weighing babies. They were not weighing their babies to know their weight. And they also believe that the colostrum was bad. So they discourage mothers to squeeze it. They encourage mothers to squeeze it till the mature milk comes. And they were also restricting food intake during pregnancy because we're told that when you are even pregnant and you take in snails, your child will drool. Those are some of the misconceptions they have. And also, another harmful practice is using razor blade to cut the umbilical cord. Yes, please. And they were not detecting complications early so that they can refer on time. So we are moving to the challenges of the TBAs. Usually, the distance between their homes and the facility is a problem. And also, when they move to the referral center, some of the midwives to shout at them, maybe why they kept the women for long and all that. And also poor infection prevention practices. They usually don't sterilize their items. So it can lead to the spread of infection. And then inadequate formal education. So because of inadequate formal education, it leads to incorrect use of delivery instruments or kits. And also inadequate record keeping. Because they are usually illiterate, recording deliveries could be a problem to them. So please, we are moving to the interventions. So the main interventions are training and education. We have to train them on basic practices. And although we are still not encouraging deliveries at home, but maybe around that area, if there's a TBA there, at least you should train them on clean delivery training and essential newborn care, which is the basic ones they can do. And also resource support. We have to provide clean delivery kits to them. Then with the medical and clinical support, we have to encourage the other facilities to liaise with them so that they can refer the labor cases to them on time. And also with the referral pathways, if we can provide them with any small car or something so that they can refer their cases on time. So there are also advantages and disadvantages of traditional birth attendants. With the advantages, they are community-based. That is, they are based in the community with the pregnant women, and they are sought out by women. Usually, the pregnant women go to them and they teach clean childbirth because they are experienced. They are able to teach the pregnant women, though some of their practices are harmful and we have disadvantages. They don't have technical skills, and then they may keep the women away from life-threatening, away from life-saving interventions due to false reassurance, even though they cannot conduct the delivery or something, but they will still give false reassurance to them. Okay, so in conclusion, TBAs play a significant role in maternal care. Those WHO strongly advocate for skilled care at every birth in order to reduce high maternal and neonatal mortality and morbidity worldwide. So please, these are the group members. Then our references. Okay, thank you.
Okay, thank you very much. Please, can I look at the group members? Please, is it Nyamichi? Nyamichi, please, are you part of the group? Nyamichi? Okay, can I look at the group members? All right. Okay, thank you very much. So it's 5 minutes for questions. So please, if you have any question, kindly put up your hands. Please, can you go to your topic for us if there is any question before I will come in with my comments? I think we will pick questions. Please kindly put up your hands if you have a question for group 1 so that we can pick the next group. All right, thank you. Okay, so Asana.
Yes, madam. Please, good morning.
Good morning, how are you?
Fine, thank you. Please, my question is about the bad practices they do. Using razor blade. Is it the razor blade is bad or because she left it in vague as to whether new razor blade or using razor blade? Because we did a training and what we taught them was that they don't have cord scissors. So for that reason, they should be using the razor blade to cut the cord. It should be a new one. So during our education, we always allow the woman, when she's pregnant, to buy new blade into her things. So anytime she's going to deliver, midwife or whoever is doing it, the TBA, sorry, to use it. But here, it is being considered as a bad practice. I don't know whether the razor blade is used for all. That one I know is a bad practice, but she left her statement in vague. Thank you.
Thank you. I've even putting it down because now midwives are even using the razor blade when they are not getting there. So it should be specific, maybe infected razor blade or something. All right, thank you. Any other question for group 1? Asana, please, you can put your hands down. Okay. Okay, so please, the co-host, please do your work. And I don't know. There's one person, is it, I want to ask her a question. This is Namishi. All right. All right, so group one, if there is another question for you from Adams.
Hello, madam. Good morning.
Hello, good morning.
Please, mine is not a question, but a contribution.
Okay.
The harmful practice she mentioned, some of them, when there's a obstructed or complication, they attribute it to gauze, like it's the gauze that is punishing her because of the bad thing she has done. So that is one of the harmful practice they also do. Thank you.
Okay. Any other question for the group so that we can move on to group two? Group two, please, can you send me hi on WhatsApp to confirm your work? All right. Okay, so in case, please, group one, I think I can come in now. So I will start from the positive. It was a very nice and educative presentation. Well done for the presenter to show up and then present for us this morning. But I also have some few comments. Now, the comment number one, your work, you were not having objectives. You did not set an objective. So we didn't know what we should expect at the end of your presentation. So there was no objective. And when I gave you the presentation outline, it was stated that you should state your objective using the SMART. So please, the other groups should take note. And then number two, your headings. Your headings were mixed with your work. Okay, your headings were mixed with your work and they were in small letters. Small letters in the case of the first word. So please take notes. And your images were very blurry. And I remember I commented this when you sent me your work, but I don't know, to add more images because we are talking about the TBAs. When you add more images to your work, it makes the presentation nice. So please check. Then the next thing that I have, the next problem I have is there is no in-text referencing. In-text referencing. Can you go back to your referencing list? I want to check something from there. So you should, any statement that you made that is not coming from you, you should reference the person in the work. And that is what we call the in-text referencing. And I told you to use APA referencing system. So if I look at your reference list, for example, look the reference, the R is capital, small r. That is what I was talking about. So in-text referencing was not there. Then your reference, you were not using the APA. APA, you were not using APA. Look at, for example, Boahemaa. This is not APA. APA now, we are using the 7th edition. And it was stated in your work. I remember I commented on using the APA referencing system. So please do the corrections and then you resend the slide to the page for everybody to have access to it. And I said, if you're using article, okay, it should not be more than 5 years. I think I limited you articles and books should not be 10 years or something, but at least articles like this, it should not be more than. If it's a definition, that one is okay. But if it's not a definition, we should stick to the 5 years. All right, so thank you very much for the presentation. Please, can you take off your slide and then we'll pick the other groups. Group 2, please, I'm still waiting for your response. Okay, group 2, I can't see their response. Group 3, please, are you ready?
Yes, sister.
Group 3, please, are you ready?
Yes, sister.
Please project your slide. Barbara, please, are you in group 3?
No, sister.
Group 2, please, I am waiting for you. So please send me the hi. Please, if you send me the hi, add the group to your messages.
Good morning, colleagues.
Okay, good morning. Okay.
Mm.
Please, who is the presenter?
Please, it's Alom.
Presenter, your name?
Alom Agbosu.
Okay, Agosu. All right. We wish you good luck. You have 15
Thank you,
minutes for
sister.
the presentation, and then we use 55 minutes to contribute, okay?
Okay, thank you, sister. Please, I hope my slide is showing well.
Yes, we can see. You can continue.
Okay. So we are group 3. We are presenting on home visiting. So this is our presentation outline. We'll be looking at the definition, the objectives and principles of home visits, types of home visits, requirements for home visits, preparation that you have to do before going for home visits, and then the steps in conducting a visit. Then the final one will be looking at advantages and disadvantages of home visits. So home visit definition, we are saying that it is a component of primary health care which seeks to meet the health needs of the client and then their families and their doorsteps.
Slides are very small.
Please come again.
Please continue. Continue. Please,
Okay.
you can put your comments down. After that, you ask the person, okay? All right.
So home visit on maintaining their health to reduce mobility and mortality rates, and then to ensure that the clients and then their families attain optimum health. So when it comes to the principles and the objectives, one of the principles that we are looking at is before you start or before you conduct a home visit, it has to be planned. And then you have to make sure that at the close of every home visit, you have met your purpose or you have achieved your objective for that home visit. And then home visits should also be made flexible in such a way that the client will feel comfortable and then will be involved in taking care of their health needs as well. Then when we come to the objectives, some of the objectives of home visit is to trace defaulters and then make follow-up on referral cases. Then also to assess the family health needs and then help them solve their family health needs with their available resources. And then also, it's also a means of surveillance and then to improve on our health indicators too as well. Then we move to types of home visits. We have two main types of home visits. We have the regular or the routine, then we have the special or the planned home visits. When it comes to the regular home visits, it is just the normal visit that any health worker will do to a client. In that case, you don't need to know the client. So maybe you are just planning to go and visit a particular community. And then maybe you have planned that you are visiting only 3 homes or 4 homes. So in that case, you don't know the client that you are going to visit. But when it comes to the special or the selected home visit, that one we are being specific, meaning the client that you are going to visit, you actually know the health needs of the client. So you are tailoring all your health educations, your assessment, everything will be tailored exactly towards the client's health needs. Unlike the regular home visit where you go in to find the problem and then you now help the client in solving the health needs. So this is how the home visiting bag looks like. Then when it comes to the requirements, there are so many things that you have to include in your home visit. So we have mentioned them here. I'll just mention a few. We have the fetal Doppler, we have the cord clamp, we have the examination and then the surgical glove, we have the sterile, the cotton wool swab, delivery sets, wood dressing sets, family planning devices, and all the others that we have mentioned here. And most of the times, when you are packing your home visiting bag, depending on the kind of visit that you will do, will determine exactly what among all these things that we've mentioned that you have to put in your home visiting bag, especially if you are going for the special home visit. Since you know the client that you are going to visit, you know the health need of the client, you have to pack exactly what you need to solve the client health needs at that particular moment in your home visiting bag. Unlike the routine home visits where you don't know your client. So eventually you have to go with everything so that in case you meet any health problem at all, you should be able to solve it. So preparation, before you go for your home visit, first you have to identify the area that you are visiting. Then you have to identify the number of homes or households that you have to visit. Then you look at whether you are going for a routine home visit or you are going for a special home visit. Like I said earlier on, that will help you in packing your items in your bag. Then you have to look at your time that you have to start your home visit and then the time that you have to end your home visit to as well. Then you set your objective for that home visit. After which you go ahead and then you pack your bags, the items in your bag. Then you arrange for transport, means of transport to wherever you are going. Then you now carry out the home visit as you have planned. So when it comes to conducting the home visit proper, once you get to the home of the client, you greet, you try to create rapport, you make them feel comfortable and then have that trust in you so that whatever you go there to do, you also feel free, and then at the end of it, you'll be able to achieve the purpose of that home visit. So you greet the client and then you introduce yourself. If you have any of your colleagues with you, you introduce your colleague as well, and then the family members that are around you, you equally greet them. Then you state your purpose of home visit. Then you ask for a clean area to put your bag. And then one of the items that we have in the bag too is a clean rubber Macintosh, where you remove it and put it down and then put your bag on it as well. Then once you are doing all that, you are trying as much as possible to observe the environment and identify any other health needs that the client is having. Then after which you prioritize the client's health needs and then you help the client solve it by using the available resources that they have around with them. Then if there is a need to perform a physical examination, you go ahead and do that. But always remember that once you have to do something like this, you need privacy. So you'd have to ask for a convenient place and then you take the client there and then you do that as well. Then you go ahead and perform your nursing care and then your health education. After which you ask for feedback, you document your findings. After that, you plan for your next appointment and then you thank the client for accepting you and then giving you a very good hospitality. So we move on to the advantages of home visits. Some of the advantages of home visits that we are looking at is a way in which it helps us to collect health data, which in turn helps us in planning whenever we are planning for our logistics for health. Then it also makes the client and family more relaxed because they are in their homes. It makes them more relaxed and then they are able to contribute and involve themselves more in promoting their health. Then it also helps build interpersonal relationship between the client and then the health worker. It also helps in assessing the individual and then the family in action, in the sense that once you are visiting the client in the home, assuming it is a nursing mother or a postnatal mother, You observe her breastfeeding in the home, and then if there is any correction or that you need to do, you do it there and then. So you meet them in action, doing whatever education you might have given them earlier on. And then once you meet them in action, you'll be able to build more on their knowledge to maintain good and positive health. Looking at the disadvantages, it is time consuming in the sense that, assuming you are alone in a team zone, and then you are the same person that is taking care of other clients, meaning you have to move. Once you are moving from the facility to the home, it takes a longer time. Sometimes from the facility to whichever community that you are visiting to, sometimes it can even take you more than an hour. And then it is also equally expensive too, because once you are doing the visiting, you would have to take care of all the expenses in terms of transporting yourself, in terms of getting the items into the home visiting bag and all other things. Then the health worker safety and security is also equally compromised, because there are some of the communities that even when you are going, you realize that you don't even meet anybody on the way. You'll be alone on that route until you actually get to the community that you are going.
Do something proper. I go and paste them bath.
If anybody wants to attack or harm you, it is easy for the person. Secondly, too, even if you get to their home and then you happen to meet somebody there that may want to harm you, so in that case, it compromises the security of the health worker as well, which is a disadvantage. Then in the community or in the home too, the midwife or the health worker have less control over the setting because you have other family members around. So sometimes there are certain things that you want to do without them. Even when you are asking them to give that privacy, some of them wouldn't want to adhere to it. So you don't have that control over the setting or the environment. Then it equally limits the access to consultation and other health professionals, in the sense that assuming you get to the home right now and then the client needs to do some lab investigations, obviously there are not things that you can carry with you when going for home visit. So in that case, it gives you that limitation. And then you have to end up referring the client back to come to the facility to have access to those other consultations. Then it's also equally limit the midwife access to technology and then medical records. In a sense that once you are using the computer system, there are some information that you may want to reflect or go back into the system to find about the client, but because you have not gone with the device, it limits you, the health worker, to be able to go for all those information. So that is our picture gallery showing a community health nurse and a midwife on home visits as well. Summary. In conclusion, home visit is an important component of primary health care. The two main types of home visits, that's routine or special home visits, the component of home visiting back. Then finally, home visits strengthen the relationship between the health worker and the client, and it helps in collating health data for decision making. Thank you. This is our group name. We actually forgot to add our references. So I think we'll do that when we are doing the final correction and sending. Thank you very much.
All right, thank you very much. Can you go back to your topic for any question and contribution? In fact, I am more interested in the group list because I'm looking at those who have been making noise because I'm writing their names down. I want to find out if they are part of the group because it's not easy. If somebody is presenting and you are disturbing the person, in fact, there is it will get to a time Agoshi will have to stop and then wait and see if somebody want to ask her a question. Please. Okay. So let's pay questions and contributions. Selena, your hands is up.
Sister, please, good morning. Please, we are group 2, and I'm sorry, our my network wasn't favorable for me. So please, Please, once the group
send me
3
hi
is
on
done,
WhatsApp. I
can
will
we
check from there.
present? Please, I've done that already.
All right, so I will check. Okay. All right.
Okay, thank you.
Rita.
Sister, please, good morning. Sister,
Good morning.
on their presentation, they made mention of the home visiting bag compartment. So I wanted to find out whether the compartment, whether they can throw light on what is supposed to be in the various compartments. And they only mentioned the compartment. They didn't tell us that I know there are three: outer, inner, and then the other aspect of the compartment, but they didn't talk about it. So I want to find out whether they can throw more light on it. Thank you.
Please, presenter, go to the home visiting bag for us and then answer the question for us, please.
Okay, so this is the home visiting bag. We have two types that we have actually shown here. So like my sister equally said, we have three compartments. We have the outer and then the other two inner. So for the outer one, like I did mention earlier on, some of the things that you have to put on the other one, the outer one is the rubber Macintosh that you have to lay on whichever surface that they have presented to you before you put the home visiting bag on it. Then the two inners, we are looking at the part that will contain the sterile items, and then the other part that will contain the non-sterile items. I don't know if I'm to mention all the sterile items and then the non-sterile items.
So she want to know the compartments, because when you did the items, you just missed them. So please, can you take her, maybe this compartment, these are the things should be there and that.
Okay, so for the one of the inner compartment I said contain the sterile items, we are talking about sterile items like the sterile cotton wool, the gauze, the sterile delivery sets, the wound dressing sets, and all the other ones. Then when it comes to the non-sterile items, we are looking at the thermometer, your fetoscope or your Doppler, your thermometer, your hand sanitizer, your methylated spirits, your soap. So those other items that are not sterile, they are the ones that we are putting in the other compartments that contains the non-sterile items. Please, are you clear?
Yes, please, I'm clear.
Yes, thank you.
So please, in short, how many compartments do we have?
Since we have three main compartments.
And they are?
The outer one and then the two inner ones.
Please, we have the outer, the inner, and the middle compartment.
Okay, please, another question. Rebecca.
Yes, sister, I just want to add up with what my sister just said. So with the compartment, as she said, we have three, where we have the inner, outer, and then the middle. So we have one compartment where it's supposed to be lockable for the patient items to be kept in. And then one also should be a clean disposable compartment where we also have our surgical gloves and other things. And then the third compartment should also contain our non-sterile items to be able to go and use it at the home visit. So that's what I wanted to. Thank you.
Okay, thank you. Please, any other question for group 4? Group 3. Group 4, please get ready for the next presentation. Okay, any question? Okay, Patricia.
Good morning.
Good morning.
Please, I'm supposed to present at group 2, but I had a little bit challenge at my
It's
with my
group 2.
network.
I have make a comment with your group leader. So
Okay.
contact her.
Okay. Thank you.
Okay, so please, any other question for group 3? Group 3, please, can you, if there is no other question, I want to give my comment. Can we start from the beginning? So the first comment is a nice presentation. Nice presentation. Well done, group 3. So can we start from the beginning, please? Okay. So in the same way, you were not having an objective. There was no objective for your presentation. So we didn't know what to expect at the end of your presentation. That is number 1. So please take notes. Now, please, I also realized that in each of your headings, there is a full stop. Agosu, please, are you listening? The group 3. Agosu, you see, at the end of every heading, you were having a full stop there.
Okay, sister.
So you have to remove the full stop.
Thank you.
Then, go to the next slide. There is no in-text referencing. Can you go to the next slide, please? Yes. What are you defining? You are defining home visits. And it's a PowerPoint presentation, and you were supposed to use only points, but here everything is joined together, which makes it like a word presentation, but not PowerPoint. So most of your slide, it was loaded. And I think I have commented on the page. So please work on it. And then there is no in-text referencing. So I wasn't surprised when you were not able to show me your referencing. So it means you did not do your referencing, because where you pick the definition from, it's not coming from you. And so you should reference that person, because in academic, if we don't reference that person, it's very, very, very dangerous. If it's coming from you, fine. But if it's not coming from you, then it's a problem. Can you go to the next slide? Yes. Your principles and your objective. Principles and objective of what? So your headings were not specific. So for example, principles and objective of home visits, then we will know. Okay. So let us know what you mean by that. And then the principles has been underlined and italics. It's a presentation, so please check. Please check. So we didn't know what objective are you talking about and then which principle. Can you go to the next one? The same way so if I was the one presenting and I want to talk about type of home visits, I would just bring the heading, routine types of home visits, routine, and then special home visits. Then I will bring images about the routine, and I'll bring a client. I wouldn't bring so many explanations. You see, the moment you explain and you load your slide, it becomes no more PowerPoint, but a word presentation. And when you do that, you'll not be able to see, when you start, somebody comment that is small, and I ask the person that you should let you finish. Because when you do that, you'll not be able to increase your font size to 32 so that we can see. So please go and work on it. Work on your referencing and your in-text referencing using the 7th edition of the APA referencing system. Thank you very much. Please, you can take off your slide to make a way for group 4. Okay. Group 4, please, are you online?
Yes, sister.
Hello, sister.
Please project your slide.
Hello, sister.
Please project your slide, group 4. Please, I'm still waiting. Please, I don't want the slide this way. I want it large. That's why I said we should all use our laptop, because if we're using the phone, please, can you go to the first slide for us?
Hello, sister.
Okay. Yes. Yes.
Sister.
Yes. Selena. Oh, it's not Selena. Okay. So who is the presenter for these groups? Selena, are you the presenter?
Hello, sister. Sister.
Yes. There are
Yeah,
so many sisters. Esther, you are the presenter.
Yes, please.
Okay. So apart from Esther, please can we all mute ourselves to make a way for her? Selena. Okay. All right. So Esther.
Okay.
I wish you good luck. Esther.
Yes, sister.
All right. Good luck. You can start.
Thank you. All right. I'm Esther Boahemaa, and I'm presenting on behalf of Group 4. And please, we are presenting on Nursing and Midwifery Council rules concerning midwifery practice. And the introduction. In Ghana, we have a regulatory body that is responsible for the midwifery profession, and that is the Nursing and Midwifery Council, which is the NMC. And the NMC sets rules and regulations that governs the midwifery practice in the country. And then here are some of the regulatory rules that govern the midwifery profession. Yes, sister.
Esther, please,
Yes,
there is a noise coming from your background. Can you position yourself well?
Okay. Yeah, please, is it okay? Sister.
Yes, it's okay.
Okay. So the rules regulating the midwifery profession. First of all, before you become a midwifery, you'll be able to practice professionally in the midwifery practice. You need to be able to undergo education or training, which in our country we undergo about 3 years training. Then after the training, you maintain a register. That is, you register with the NMC, the National Midwifery Council. Then you'll be able to practice professionally, or you'll be fit to practice as a midwife. So the NMC do all these things, or put all these things in place to safeguard the health and well-being of the public, so that you, the midwife, will be able to gain the knowledge necessary to practice, and then you'll be able to be recognized in the National Midwifery Council to practice as a midwife. Now, the scope of practice. The scope of practice talks about how we are supposed to practice as a midwife. That is, when the clients come or when the patients come, you have to assess the patient and then diagnose the patient, plan the care that you give to the patient, and then you implement the plan that you've put in place. After implementation, you evaluate whether the plan that you implemented has been successful. If it's not, then you go back again to do your assessment again, and then plan another care to make sure that the care that you provide is successful.
Hold on. Edna Okra, please, are you in the group? Edna, she has been disturbing the class. If we mute her, he will come back. Where are my co-hosts? Abigail, you are offline. Dorcas.
Sister, I've been muting them, but they still unmute themselves. I don't know why. And we are all supposed to listen to the lectures too and the presentation too.
Don't worry, I'm putting their
Must we ask you to mute your mic before you do that?
All right, presenter, sorry for that. Please continue.
Okay, sister. Please, these are some of the professional conducts and then ethics that we are supposed to practice as a midwife. One is that we need to have respect and dignity of the person or the client that you are taking care of. You need not to shout at the client. You have to always listen to her concern and then provide the necessary respect. Secondly, we need to provide responsibility. Sorry, sister. Secondly, we need to have professional responsibility and accountability. Whatever that the patients, when the patients come to our care, we are responsible for the patient. So we need to provide the necessary responsibility for the patient, and whatever that we do for the client, we need to be able to account to it. And then thirdly, we need to provide quality of care or quality of practice. Whatever care that we administer to our patients or our clients, it has to be the quality of it. Then the principle 4 says trust and confidentiality. We need to make sure that we build trust between our clients and ourselves. Then provide confidentiality. Whatever that is about the patient or the condition of the patient, we have to make sure that we don't disclose it to any other person or even any healthcare provider who is not connected to the care of the patient. We have to always provide confidentiality. The principle 5 says collaboration with others. So as we are providing the care for our clients, we need to collaborate with other health workers like the doctors, the laboratory personnel, so that together we form a team and then provide quality and safe care to our clients. And also, these are some of the standard practice that we need to practice as a midwife. One is proficiency standards. Midwife must demonstrate essential skills, knowledge, and attributes. These standards guide their practice comprehensively. So as a midwife, we have to know what we are doing. Whatever care that we provide or whatever education that we are giving, we need to know what we are talking about or what care that we are giving. We need to be knowledgeable about everything that we provide for the clients. And then secondly is code of conduct. We need to be able to adhere to the code of conduct as we learned earlier. We have to have respect for the clients. We have to maintain confidentiality. We have to be responsible for the clients. We have to maintain all this code of conduct to help us to provide quality and safe healthcare to our clients. Then we have legal framework. The Health Professions Regulatory Bodies Act 2013 mandate the highest standard in nursing and midwifery training and practice, ensuring public interest and safety. So in our profession, we also have a legal framework that governs it. So that if you go or you're not able to follow the rules and regulations or you undermine any of it, there are legal framework that is going to be taken, legal action that is going to be taken against you, or look into the case for them to know whether you are for them to know whether you have a good side or you actually undermine the rules. And then we have education standards. The International Council of Nurses defines standards for nursing and midwifery education. This standard serves as a guide for educational institutions, ensuring the quality of education and practice in the field. So as I said earlier, before you become a midwife, a professional midwife, we have our system of our country has put in place that you need to undergo education and training before you can work as a professional midwife, so that you can provide quality of healthcare to the clients. Please, we have ways of improving the rules and regulations, and this talks about the things we need to put in place to ensure that the rules and regulations are maintained or are improved. And one is that we need to strengthen our leadership and our policy. So there has to be a leaders that will always make sure that the rules and regulations that they have put in place to govern the profession is always being adhered to. Then we have to gather data and then evidence. You have to build public engagement and then advocacy. You have to prepare educational institutions, practice settings, and clinical mentors. So we have to get educational centers, educational institutions, so that if anybody is interested in becoming a midwife, that person will go there for training. And there has to be settings for clinical mentors, and then place of practice. So after the education, you have to get a facility or an institution, hospital, for us to go there and practice what we learned in school or in training. And there has to be strengthened faculty standard and curricula. We need to educate students, as I said earlier. And after all these things, all these things have to be monitored, evaluated, and reviewed. If it is not well adhered to, or if it is not being adhered to, they'll review it and adjust the regulations, or adjust all these things to make sure that the regulations, the rules and regulations are being adhered to or are being improved. Benefits of adhering to rules and guidelines. These are the things that that is the importance of adhering to the rules and regulations. If you're able to adhere to the rules and regulations, midwives by following rules, midwives ensure the delivery of safe, high quality care to their clients. So if you are able to adhere to the rules and regulations, you'll be able to deliver safe care and high quality clients. Like if you're able to build trust, if you're able to ensure confidentiality, the patient or our clients will have trust in us to be able to voice out or open to us and tell us what is wrong with them, so that we also provide the safe care that they need. Then 2, adherence to guidelines foster trust among patients, colleagues, and the wider healthcare community. So if we are able to provide confidentiality, the patients will have trust in us and make sure that whatever they will know that whatever they tell us about themselves, we will not disclose it to others. So it will build trust among ourselves, and then the patient or the client. Compliance with regulations shields midwife from legal and disciplinary actions. So if we are able to follow the rules and regulations, it will help us to refrain from any disciplinary actions, from legal issues. We will not be able to encounter any legal issues. That is, if you're able to go according to the rules and regulations governing the profession. Then lastly, guidelines uphold ethical considerations, fostering trust between midwives and patients, and maintaining the dignity and rights of individuals receiving care. So these rules and regulations always help us to maintain the dignity and rights of individuals receiving the care. And like I said earlier, it fosters trust between us, the midwives, and our clients or our patients. The consequences of not following the rules as a midwife. One of the consequences is that misconduct may result in warning, reprimands, or restrictions on midwifery practice. So if you are being caught that you are not following the rules and regulations governing the practice, either you'll be reprimanded, or you'll be restricted from even practice, to be restricted from being practiced as a midwife. So that is it. Then fines or legal actions may be imposed for violations impacting midwives personally and professionally. So if you are found to have any legal issues, or you are found to violate any of the rules, you'll be fined to pay an amount of money or something to serve as a punishment for violating the rules or regulations. Patients, colleagues, and community may lose confidence in a midwife who fails to uphold regulations. Yes, so if you are not able to follow the rules and regulations, and it is being made known to everyone, even other patients at the ward will lose trust in you. Your colleagues will lose trust in you, and the community as a whole will not even have confidence in you, the midwife, because you are not able to uphold or abide by the rules and regulations of the profession. And these are the steps before facing consequences for not following rules for the midwifery practice. So before there will be consequences or there will be any punishment, an allegation will be made or a complaint will be made that this is what we have done, and it will go to the legal committee or legal people. They will take the issue and then try to investigate. They will form an investigation committee to investigate your issues, and there will be case examiners to examine your case. So at the end of their examination and their investigation, it will be that the case will be dismissed, maybe if it isn't true, or at the end of their investigation, nothing was found, it will be dismissed. And then you'll be fit to practice. You'll be fit to practice. Or if it is true, they'll either caution you or they'll let you maybe work for up to 3 years to monitor you. Then if not that, then you'll be suspended for up to 12 months. Then if not suspension, either they will erase you or they will take your license and sack you from the midwifery profession. So please, this ends our presentation. This is our reference. This is our reference. And then our group members. These are group members. Thank you, sister. Thank you very much. Hello, sister.
All right, thank you very much. Please, can you go back to the first slide? All right, thank you. Please, any question or contribution for the group? Anybody? Any question for group? Please, group 2. The person who sent me the work, I have sent her a reply, but the person is not minding me. So group 5, get ready. Okay. Augusta.
Hello, sister. Good morning.
Good morning.
Please, I want to add, I'm not in the group, but I just wanted to add today.
All right.
Please, in her presentation, she said that the midwife has to go through a 3 years training. So I just want to ask that we have different, like about 3, I don't know how to put it, but we have the top up, which is the post basic, then the direct, that's the 3 years, then the 4 years BSc. That's what I want to add. So hello.
Yes, okay. Well noted. That is very true. Please, any other question before I will come in? Okay. Augusta, please, can you put your hands down, or you have another question? All right. Okay. Oh, yeah. All right, so I think I can come in now. Please, group 5, get ready. Okay. Now, it's a very nice presentation. A very nice presentation. Well done.
Hello, Mr.
Yes.
Boahemaa.
Selena, you have been disturbing us in and off. What is it? Are you a group member, Selena? Selena, are you a group member or you want to ask question? Where's Selena? Selena, she will go and come back. Hello, sister. What is, where is Selena? Okay, I think the network. All right, so let's proceed. So it was a very nice presentation. Well done, group 4. Well done, group 4. Okay, but I have some few comments. Now, can we go to the next slide? All right, and the same way for the group, no objective, no interest referencing. You don't have an objective, so we don't know what to expect from your presentation. And then you don't have interest referencing. Your interest referencing are not there. So please write it down and take notes. And then I was expecting you to give us brief history of the Ghana NMC in a chat form, a brief history. And then I was expecting you to introduce with the history, your introduction to capture the history. And then who is the registrar? Assistant registrar now, which is very, very important. But I didn't note that.
Sister,
Selena, Nanadua Asantua Ashanti. Please come, Nanadua Ashantua. Once you see, that's why we say don't unmute yourself. You see how you are talking and the class has been recorded. This will be pasted on their platform, YouTube. Everybody can watch. So you see how Nanadua Asantua Ashanti, index number 608. You see how you have disgraced yourself. Please, group 4. Can you go to your next slide? Group 4, okay. So I was expecting you to state the registrar, and Anadra Santo was even saying he doesn't know, you see. So please add it and let us know the assistant registrar or the registrar of the NMC. And can you go to the next one? Your voice was very low, and somebody was commenting in the chat box. Your voice was very, very, very low. So I think that was the next one. Can you go to the next one, please? Then we were expecting you to talk more about PIN renewal, the renewal of our PINs. And then you should let us know the consequence of expiring, practicing without PIN, or practicing when your PIN has expired. Because right now, if I should ask how many of you know the renewal, the rules and regulations concerning renewal of our PINs, it's very, very important. You can't practice when your PIN has expired. So please add it to your comment session. Can we go to the next one? Can we go to the last slide? Yes, here. Now, I have a problem. This is a word presentation. No, before this one, practicing. There was something like practicing something good. Here, for example, it's a PowerPoint. So you can just bring code of conduct without explaining. You see, the moment you explain, it doesn't make it PowerPoint again. It becomes a word presentation. And I'm teaching you how to do PowerPoint. So please take your how to do PowerPoint presentation, take it serious. It's very, very important. And I remember last week I met somebody I have taught somewhere, and the person was doing the presentation. And after the presentation, everybody was clapping for that person. So at the end, he came to me and he says, Sister Boahemaa, thank you very much for teaching me how to do a PowerPoint. So for example, this one, you could have bring only the point. That is why we call it PowerPoint, without explaining. You should rather read the explanation, like when I'm teaching, so that when you mention the points, then you now explain to us. Okay, so please take note.
Okay, sister.
Can we go to the last slide? Last slide, where we have the referencing. Good, referencing. Okay, now the referencing is not APA, and you can see some of them you have highlighted. They are in capital words, scope of practice for nurses and midwives in Ghana. So please go back, you can even download the APA referencing system, the 7th edition. And I think I commented on it, but it didn't still work on it. Can we look at the group members? Okay. Go down. Down. Is that only, you are only 11 in the group? I want to look at all of them. Please go up for me. Up. Okay. Thank you very much. Can you take off your slide to make a way? So please do your corrections and let's have the final one on the page.
Thank
All right. You are welcome. Can we pick group 5? Please, group 2, I have made comments on your slide. But the person
Sister, there is no comment there. There is no comment there, sister. Please. Since Wednesday that we sent the word to you, we haven't received any comment. Please, sister.
No, right now I have sent. Are you not the rep?
Yeah, I'm the rep. I've received. Have I commented on your work? Not yet. You haven't. Sister, please. I don't know. I don't even know what to do now. Again.
Don't worry. I'll comment from there. So you let's start from there. So you are the Selena who has been disturbing us.
Sorry.
All right. So we have the next group. Okay. So, okay. That is for group 5. Please, group 7. I'm still waiting for your high. Group 6. I think we can pick only one group after group 5. And then we call it a day. Okay. Are you ready, group 5?
Yes, sister.
Okay, so I wish you good luck. You can start.
Thank you. Okay, good morning. Please, I'm Noreen, presenting for group 5. We are presenting on private hospitals and maternity homes. So our learning objectives for the presentation. So by the end of the presentation, we'll be able to know the definition of private hospital and maternity home, the rules and regulations governing private hospital and maternity home, requirements for setting up a maternity home and private hospital.
Okay, but that's it. Oh, hi.
The presenter.
Good morning. I wouldn't buy it.
Who's the presenter, please?
Please, Noreen. Noreen is the one presenting now.
Okay, continue.
Thank you. So the last objective is we'll get to know the board governing the private and maternity homes as well. So we are saying private hospitals and maternity homes. The private hospitals and maternity homes, they typically provide medical services for expectant mothers. And when we say providing medical services, we are talking about prenatal care, labor and delivery services, postpartum care as well. And then these facilities, normally they offer a range of personalized care that enhances experiences during childbirth as well. Please, can we move on? Okay, so we have the functions of maternity homes. So most maternity homes provide all the basic functions that we provide in our various hospitals as well. So we provide antenatal care for the mothers. There is assessment, management of labor and delivery. We have the immediate post-delivery observation of mothers and babies as well. They provide the postnatal care as well. It also acts as a center for clinical training in midwifery and obstetrician. So we are saying some of the maternity homes also provide training for midwifery students and other healthcare personnel as well. So we have regulatory bodies requirements. So we are saying that the maternity homes, just like other healthcare facilities, they are subject to specific regulatory bodies, and these include licensing and accreditation. So as an institution, you have to be licensed, you have to be accredited under a regulatory body. They have facility standards. The facility should be based on the standard that is required by the regulatory body. Qualified staff. You should have staff that has been trained purposely for that particular services you are rendering. You have staff being, normally you go to some facilities, staff being trained on the job that they are working with. That from the regulatory board, they're supposed to have qualified staff that you are working with. You have medical services. Provide prenatal services, provide delivery services, provide postnatal services to the client as well. And then emergency preparedness. The facility should have things set aside for emergency, when they have emergency cases as well. Then adequate equipment and supplies. The facility should have the needed equipment, needed supplies that will be used for work in the facility. So everything that you need for delivery, antenatal services, all those things should be available in the facility. Ensure privacy. So in our course of work, what we do, we know that ensuring privacy is very necessary. So the facility should have everything in place, making sure that the client's privacy is maintained as well. Then educational programs. We are saying that the facility should make itself available to help in providing education services for health personnel who come there to work as well. Thank you. Okay, so private hospitals is owned, funded, and governed by a group or individual person, managing the whole finances on their own. So when we say something is private, it doesn't belong to the government. It belongs to either an individual or a group of people. So they manage everything, the finances, the supplies, everything is managed by those people or that person. So the functions of a private hospital: diagnosis and testing. So we know that a hospital should have a laboratory space that does these services. Treatment and therapy. Treatment and therapy in the sense that you have enough and essential things to be able to treat clients that come to the facility. Then care of emergency. Every facility is supposed to have the needed emergency prepared requirement to be able to attend to any emergencies that come to the facility. Preventive health awareness. And then conducting research. So just like our public hospitals that we are in, that we do conduct researches in our various facilities, the same way the private hospitals also do these things as well. So Private Hospitals and Maternity Home Act, that's the 1958. So it's an act was passed for the private hospitals and the maternity homes in the year 1958. So under the Section 3, it was stated that the private hospitals and maternity homes should have an established board, and that board should consist of a chief medical officer who is going to be the chairperson of the hospital. And then you have another deputy chief medical officer. It should have a principal matron, 3 medical practitioners, 1 midwife, 1 nurse, and 1 registered pharmacist. So these are the people that constitute the board of the private hospital or maternity home. Registration of private hospital. No person or a group shall establish or conduct a private hospital or maternity home unless the private hospital or maternity home is registered under the provision of this act. So we are saying that no person or any group should establish any private hospital if the private hospital is not under the Maternity Home Act. So if that company, let's say if that company is not registered under the Home Act, it's not considered a private or maternity home. So inspection and supervision, just like our public sector, we undergo supervision and inspection as well. So the private hospitals, all private hospital or maternity home shall be all times supervised by regional supervisory authority. So they normally come in maybe once a month or twice in a month to do supervision. And when they come on it's normally a support supervisory something that they come to do. They will come and check whether the things they have placed in for the facility to be doing, that is what they are doing. And they would be checking your supplies, your staffing, all those things that are we said during the regulatory bodies, all those things, they'll come and then inspect and then supervise the things in the facility. So, penalties. So with any private hospital or maternity home who goes against this act or fails to comply with the requirements commits an offense against this act and shall be liable on summary conviction to a fine not exceeding 2,358 Ghana cedis, which is equivalent to £200, or save in the case of a body corporate, to imprisonment for a term not exceeding 12 months. The offender will pay a penalty of £10 every day during which the offense continues. So we are saying that with every institution which have a regulatory body, it comes with penalties. If you go against the regulatory system, the regulatory body, you will be fined, you'll be penalized. So this is what we are saying, that when a staff or the facility commits any offense and is being sent to the court, a fine that they are going to pay. Or if it's an offender, an individual, you'll be paying a penalty of £10 every day whilst the offense continues. when the offense is still still within the court process. If the money is not paid, that fellow will be sent to 12 months, a term not exceeding 12 months of imprisonment. Health Facilities Regulatory Agency, that's the HIFRA. HIFRA is a body set up to license and monitor facilities for the provision of public.
Hello.
Yes, sister.
Sorry for coming in, but I think the HIFRA, Nanadua again, Nanadua Santwa again. Are you the one presenting? Nanadua?
No, please.
But why? Please, what is your topic?
Private
Oh. Please, I know another group is presenting.
Recording in progress.
Hello, sister.
Yes.
Yes, I think she's off. We are presenting on private hospitals.
Yes, so it means the HEFRA is not part of your assignment, because I know a group is presenting on it, isn't it?
Yes, I wouldn't know that, but we are trying to say that the EFRA, they also regulate the private hospital. We are just trying to
okay. All right. I thought maybe
explain it.
I thought maybe it's a continuation, because just talk about it because it's somebody's presentation. Okay.
Okay.
All right.
So the EFRA is a body set up to license and monitor facilities for the provision of public and private healthcare services. This agency gives the private hospital and maternity home the licenses to operate. So with those who regulate the body or the private hospitals and the maternity home, this effort to also give you the licensing to operate as a facility. So what they actually do is once in a while, they will come to the facility to see if those working under your the hospital or the maternity home have licensing or they've been licensed to work, they are qualified to work. In a case when you don't have a license to work or qualified staff to work in your facility, they will take you on. So mostly they are also part of the regulatory bodies who control the private hospitals and the maternity homes to work effectively. Thank you. So this is our references, and then these are our references, and then that is the group members. And yeah, this is our group members too. Thank you very much for listening. If there is any questions, please.
We can't see your reference.
Oh, okay, sister. Sister, please, this is our references.
Please, can you hear me?
Hello, sister. Yes, please. I can.
All right.
Yes.
Okay. So let's look at let's take comments, contributions. Okay, Rebecca.
Yes, sister. Thank you. Please, I want a clarification because with private, during her presentation on private hospital, she made mention that the private hospital is being the revenue and account, whatever, is being managed by the facility.
But with the maternity home, I couldn't get any clarification about that. Does it mean that one they don't manage their finance on their own? Thank you.
Thank you.
Thank you very much, sister. Yes, it's the same thing. But you know, with the private, the maternity homes is being managed by the midwife.
Please, can you go to your topic? Can you go to your topic for us? All right, so that you can answer. You go to your topic and then answer for.
Okay, so basically here we are trying to say that the private one is being managed by the owner or the CEO. It's not being managed by the government. And then the maternity too is one person, it's owned by just a person. And it will be the finances and everything will be managed by the midwife or the owner. So in the same.
Please, who was the first presenter? Is the first presenter online?
But the difference between them, I think a network took her out. So I am helping her out. I'm Safia to Abdullah.
Are you in the group, please?
Yes, please.
All right. Okay.
So with the private hospital, this one is being managed. It can be a collaboration between a midwife and a doctor. But for this private hospital, a medical officer needs to be.
It's not stable. Please, your network is not good. Can we get somebody? Can you go to your topic? Can we get somebody with stable network, please?
Hello, sister.
Your network is breaking.
Can you hear me now, please?
Yes. Can you go to your main topic? That's your topic.
Yes, please. The private hospital.
So I want it this way. Okay.
Yes. And my sister was saying that she doesn't understand why we said the private hospital is being managed and then the maternity. And I'm trying to explain that it's the same thing. They are both managed by an individual, not the government. But the difference between the private hospital and the maternity home is that the private hospital, there should be a medical officer because you do diagnosing and then you do testing, your officer to help you with the private hospital. But the maternity homes, it can be only the midwife and it's owned by you, the midwife.
Please, the group members, can you come on board? She's not the only one in the group. Her network is not stable and nobody is helping. You are about 20 people in the group because the way she's going back and front, I wanted to pick another presentation. Can we get somebody to help? Your network is not stable. Let's pick another person.
Okay, sister, thank you. So I think someone.
Please, another group member with a stable network.
Hello, good morning. Good morning, sister. Please, my name is Gifty Apreku. I'm a group member.
Okay.
Please, like Safia too rightly said, the maternity home can be owned by a single midwife who has practiced for more than 5 years. And usually, if you own a business, the accountability and financial aspects all depends on you. You don't really need someone to come in unless you want to employ the services of an external accountant to do that for you. But with the private homes, the private hospital, one person cannot own it. You, the individual, a doctor, because of the higher range of services the private hospital gives, you need an independent financial account service to give transparency and accountability because it's not owned by one person. So that's the difference. But all of them need to give account for their services. Just that with the maternity home, because it's owned by one person, maybe a midwife, that is why the private hospital, we need an independent person to give them the accounts or the financial accounting so that there'll be transparency in that facility. I don't know if I made sense. Thank you.
I'm trying to. Okay, let's speak Yvonne. Yvonne. Okay, Rita.
Yes, sister. Please, I want to find out at the end of the month, how
Hello, Rita.
do they write their Hello, sister.
Okay, we can hear
Please,
you now.
please, I'm asking, so at the end of the month, do they also write their monthly report to the directorate, or where do they write, or do they, I just want to find out whether they write a monthly report and to which people.
No, that is what I wanted to go to their topic, though you are asking that question, but that is not their topic, because that is what the questions you are asking is not supposed to go. They are supposed to only talk about the private hospital and maternity home act, because the operating a hospital, operating a maternity home is also another group assignment. So I have to go back to the page. That's why I said go to your topic. Because I know that we will have somebody who will talk about, I think, group 8, they are going to talk about operating a maternity home, and they will talk everything under maternity home, because we are midwives, and they will talk about and then we have group 7, they will talk about operating a hospital. But I wanted the group to talk about only the act, so that if there is an offense concerning the act, so please, if your question is to the act, I don't want them to do the presentation. That is why I have to come here, because the HEFRA is also for another group. And then the maternity home, operating a maternity home and the hospital is also for another group. So if your question is only to the act, please, you can ask, so that we don't end up solving other groups' topics. Please, do you understand what I mean?
Yes, sister.
Okay. So Yvonne, your hands is up. Step on. Hello, sir.
Yes, sister. Good morning.
Good morning.
Yes, sister. Yeah. And please, my question is, I wanted to know where we can go for the lines in case if someone.
Okay, I think the network is bad, but I think you want to ask you, where do you get the lances if you want to open a hospital or a maternity home? That one will come under the HEFRA. That is why I don't want us to rush. So please channel your question to only the acts, because the HEFRA will give us the directions and when we want to come for the lances and those things. And then those who will be working on the maternity home. So I don't want us to do other people's topic. So talk only about the acts, the acts, the penalty, the acts. Okay, Agnes.
Sister, sorry, on my network.
Okay.
Sister, please, my network, sorry. But my question was, I wanted to know where in case if an individual wants to establish or an own private hospital or maternity home, where is the person supposed to go to get that license?
All right, so that please, if you are listening to me, if your question is not about the act, then I don't want the group to answer, because operating a maternity home is for group, I think group 6, group 7, group 8 will do that. If you want to go where you go for your lances, and they will take us through even the compartment, the inspection. If you want to open a maternity home, you should have ANC, you should have a pharmacy, you should have a scan. That is why I don't want us to go there. And I want us to ask only about the art, because that one will be for, and the HEFRA will come and help us understand what they are presenting more. Okay. So please, let's hold on for them, because I don't want them to answer questions from other groups. So I was expecting them to only concentrate on the maternity home and private hospital, only the acts, and then the way forward. So they will have ended with the way forward. That is the HEFRA. Sorry for giving my negative comment first. I should have started from the positive. So it's a good presentation. It's a good presentation. In fact, I was more interested in the art. Can you go to the art for me, where we have the penalties and those things? Can you go there? The person projecting the slide. And then your learning objective. Your learning objective, good. This is where I was interested in. This was your topic. This was your topic. Now, well, your learning objective, you have somebody in the school, but we are talking about hospital and maternity home. So your image was not matching with it. But my concentration was on this slide, the arts. Okay. This was my concentration because operating a maternity home, operating a hospital or private hospital, their duties, who take care of their money is for another group. But you were supposed to take us through the arts. And is the art still there now? This is where the HEFRA will have come in if there is time for them to present. Can you go to the next slide? Okay, so here, registration of a private hospital. So I want you to go and work more on the arts. Let's know what goes into the arts. And the rest will be taken care of by the HEFRA and then the private and the maternity home. Can we go look at your referencing? Okay, that is why when you came in with the HEFRA, I have to quickly come in and ask, because the moment I saw the HEFRA, you are now telling me the work of the HEFRA. So please take notes. Now your referencing is not APA, and you should bring us the name of the author, not the page. Okay, so, and then look at Community Midwifery book by Mrs. No, please. This is completely out of the APA referencing system we are using. And please take note, the referencing go for 5 months. So please go and then